Hello, everyone. My name is Omar, just as Kevin told you. And Tamara and I are going to present to you about equity in guideline development and share with you how we applied some of these concepts in a living map of COVID-19 recommendations. So first, I'm going to touch on what are health inequities and how they are assessed, and then cover how health inequities can be created or exacerbated from implementing guideline recommendations. And then we will cover how the grade equity, like what the grade equity recommends for guideline developers to consider health equity to basically minimize that. And then I will hand it over to my colleague Tamara to go over the recommendations map and share with you our plans for future work for assessing equity in the development of those recommendations. So the first question is, what are health inequities? So the term is coined as differences in health that are avoidable and also considered unfair or unjust. And it's common belief that inequities are caused by poverty or low income, but there are several other factors that could result in health inequities. That includes place of residence, the race or ethnicity of the individual, occupation, gender, religion, education, and social capital or social networks. And these factors, in addition to socioeconomic status, which is the income, could result into health inequities, and they form the acronym PROGRESS, which is a tool that we use to identify dimensions by which inequities may exist. And there's an addition to the PROGRESS called PLUS, and that allows consideration of context-specific factors that also might result in inequities, and they are generally categorized into three groups. First one is personal characteristics that track discrimination, like age, sexual orientation. Second one is features of relationships that may lead to health inequities, such as smoking parents, and time-dependent relationships or instances when a person may be temporarily at a disadvantage, such as leaving hospital or respite care. But it's very important to note that health inequities are present in both and within countries for many health-related issues. And an example of that would be TB. So TB is known as the disease of poverty, and it is highly prevalent in low middle income countries and responsible for 95% of the mortalities there. But at the same time, TB is very prevalent in Indigenous communities in Canada, and the infection rate is hundreds of times more than non-Indigenous people. So the way that we govern public health practice is usually through guidelines. And guidelines are documents that consist of recommendations to tell the users what they should do in specific situations to obtain the best health outcome. But these guidelines could unintentionally increase health inequities when an intervention is recommended to bring greater benefit to advantaged or low risk groups more than disadvantaged and higher risk groups. And this usually occurs when the guideline developers mainly focus on the effectiveness of the intervention. And there are implications for this, again, across countries, where, for example, the Global Forum of Health Research stated that the greatest burden of disease in rich countries is related to degenerative diseases, while in Africa, it's more related to infectious diseases such as AIDS and pneumonia. So applying recommendations that prioritize treatment of non-communicable diseases in Africa would not really deal with the issue at hand and increase inequities across countries. And this also could happen within the country. For example, in the Philippines, undernutrition is a preeminent problem in rural settings. So if there was a public national campaign for weight reduction, it would be irrelevant for those living in rural areas. So these issues have driven health equity to be universally considered as a relevant principle to clinical and public health practice. And global organizations such as the WHO have pledged to address health inequities because promoting health equity reflects the value of distributive justice for health and healthcare. So the GRADE working group, which is autonomous for advancing guideline development methodology, have established the GRADE approach in the early 2000s to assess the certainty of evidence supporting recommendations. Now, the certainty of evidence was mainly influenced by methodological factors, but recently they developed the ETD, or the evidence to decision framework, that includes 11 other criteria other than certainty of evidence that could influence the strength and the certainty of the evidence. And one of those criteria is the impact of implementing the intervention on health equity. And here's an example of a ETD table. So it ensures that the guideline developers consider all these criteria when developing the recommendation. And so things like, is the health problem a priority? What would be the potential impact on health equity? And would the intervention be potentially acceptable to key stakeholders like patients and healthcare workers, or would it even be feasible to implement? And the guideline developers would have to provide a judgment for every single criterion and provide research evidence to support their judgment. So the Grade Equity Working Group developed guidance for considering equity in the grade process. And so in the grade development process, they identified 9 areas where they believe that equity should be considered, starting from setting the priority of including equity in the guideline and ensuring that the guideline development group is diverse, to identifying and summarizing evidence related to effects on health equity and wording the recommendations appropriately, and also evaluating and monitoring the use of the guidelines by disadvantaged populations. And they also recommended 5 approaches for guideline developers to assess to assess equity when evaluating the certainty of evidence. And that could be through assessing population level inequalities, considering patient-important outcomes that are relevant to health equity, assessing subgroup effects, and looking at differences in baseline risk or prevalence, and assessing whether the evidence would be generalizable to disadvantaged populations. In fact, the working group also proposed that it might be useful to not just consider equity in that single criterion, the potential impacts on health equity, but in all of them. And basically, if you look at, like, for example, the first one, is the health problem a priority? The disease could disproportionately affect certain populations more than others, so the prioritization would be affected as well. Same thing for benefits and harms. The intervention could have different benefits and harms across, different groups. And same goes for acceptability and also feasibility. So it's very important to consider equity in all the ETD criteria to inform the development of equitable recommendations that would be genuinely fair to implement. So I will hand it on to Tamara. She will go over the recommendations map. And so, yeah, over to you, Tamara.
Thank you, Omar. Hi, everyone. I've shared in the chat box a link to the eCOVID-19 recmap that I'll be presenting if you'd like to just go to the recmap while I give you a presentation on, on the recmap. So I'm one of the co-leaders for the eCOVID-19 recmap, and I want to acknowledge that there's a large team that works on making the recmap possible. Sorry about that. I recognize some of the names and colleagues in the chat here. So thanks for joining. And for everyone who has not seen the recmap or heard of it before, today's the day. The eCOVID-19 recommendations map is a map that provides decision makers and other stakeholders with an easy to navigate, living, freely accessible electronic platform that includes all available trustworthy COVID-19 recommendations up to date that we have been able to extract and push to the map up to date, and allows to identify COVID-19 recommendations, critically appraise them, and make them available for contextualization, implementation by decision makers across the globe. And I'd like to mention that the RecMap is funded by CIHR. So here you can see where all our partners and collaborators who are working on the RecMap are throughout the world. Again, it's a large team. We have at least 50 researchers continuously working on making the RecMap possible, updating it, and making enhancements as needed. We have multiple features in the RecMap, and I'll take you through some of them right now. Again, the link to the chat box if you'd like to go ahead and give it some testing. So there are 2 options for you to find COVID-19 recommendations in the RecMap. You can either go through a list view, so all the recommendations are listed. You can use the search bar on the top left to search for anything specific you're interested in, or you can use the filters on the right. We have a long list of filters. You can narrow your search and identify specific recommendations of your interest on COVID-19. The way we capture guidelines is that we have a very strong search and screening process that goes through the different published guidelines, either manually or through APIs that have been integrated for screen scrapping in collaboration with the Health Information Research Unit at McMaster. And then we have a team that screens them. Our eligibility criteria are basic. Guidelines have to follow the definition of a guideline by WHO, can cover any COVID-19 topic, any population, and any intervention. And so in addition to the list view, we have the map view. The map view has the populations on the left, and then we have the intents on the top in terms of columns. If you click on any of the intent, you'll find all the interventions that are listed in that under that particular intent. And so that helps you find recommendations specific to your intervention and population of interest, or you can, again, just use the filters on the right. So how did we move from the recmap to equity? We worked to integrate the Progress Plus framework that my colleague and co-presenter Omar just presented during our extraction. So we've captured guidelines, we appraised them using the Agree2 tool, and you'll find all the results of our appraisal for the Agree2 tool on the recmap when you click on any recommendation of your interest. Sorry about that. And then after that, we extract the information from the recommendations. We use the GradePro software. If you're not familiar with that, GradePro is a software that is developed by Evidence Prime, and it is used for guideline development. The reason why we use GradePro for our extraction is that we've built it in a way to communicate directly to our recmap, 1, and 2, it allows us to make files for guidelines that are extracted available for other groups who are interested in contextualizing or adopting, adapting, or de novo synthesis, so development. So during our extraction, we looked at whether the guidelines covered any of the Progress Plus framework criterion. And so here you can see on the right, we have the filter for progress. So you'll see all the, thank you, Omar. So you'll see all the criteria within progress or plus, and then you can also filter by those. Now to note, while extracting, our extractors labeled each guideline. So at the guideline level, if it covered any of the Progress Plus criteria, and then if a particular recommendation added an additional consideration or anything specific to an additional criteria, it was also included. So again, the recmap presents recommendations. Our original extraction is at guideline level, and then you'll find specific details per recommendation whenever you click on any recommendation for the Progress Plus. Thanks, Omar. And so next up, we looked at which COVID-19 recommendations that were equity sensitive, so that covered any of the Progress Plus framework. Where exactly were they distributed? And for distribution, it's particularly either the guideline development group's location or the particular population of interest of the particular guideline. And so as you can see, we have the majority of the guidelines that covered Progress Plus, so any of the Progress Plus criteria, either in North America, we have Australia, Southeast Asia, and we have some of Europe. And just to say that this is this distribution is similar to that we're seeing with the general frequency of guideline development from these countries. So this is for progress criteria in particular, and then the next one is for the distribution of guidelines that covered any of the plus criteria. Thank you, Omar. As you can see, it's global, but now the question is how many did cover and how many did not, for example. So let's see on our next slide. Thank you. On our next slide, I'll show you how using the filters, using the map view, you can filter. Yeah, thank you. On the right side, you'll see the filter plus has been chosen for time-dependent relationships. And so we've identified the following 3 actionable statements. So at the 2, we have 2 additional guidances and we have a recommendation. And the difference here is that a formal recommendation is a recommendation that followed the formal process of developing a recommendation, shows the certainty of the evidence, the strength of the recommendation, and is clearly, explicitly reporting on the evidence that it has used. And so, for example, this recommendation is by the National Advisory Committee on Immunization in Canada and the Public Health Agency of Canada, and that recommends that a complete vaccine series with an mRNA COVID-19 vaccine should be offered to individuals with, in the authorized age group who are pregnant or breastfeeding. Informed consent should include discussion about emerging evidence. And so this was specific to time-dependent relationships. And so for the next one, when we went thank you, and chose from progress specifically filter for race, ethnicity, culture, and language. We found a specific good practice statement, for example, that says that persons in settings such as refugees, detention camps, prisons, slums, and other settings with high population densities where physical distancing is not implementable should be prioritized for vaccination as outlined by the WHO. And so what I'm telling you here is that you can find recommendations or good practice statements or informal recommendations or even research-only recommendations based on what criteria you are interested in for from the Progress Plus equity framework. And this is important either when implementing a certain recommendation, or either when you are looking for contextualization, or when you are aware of what particular group you are looking for recommendations for, and then these filters would help you find them. Thank you, Omar. The next one. Thank you. And so here we show you an additional guidance. So an additional guidance is a statement that did not fulfill the criteria for good practice statement. We have a list of criteria for good practice statements that you can read all about in our published papers. But an additional guidance is one that did not fulfill the criteria for that, or is not a formal recommendation, but it has been published and it's out there that could be used with some tweaks to make it applicable. So we chose here, for example, from Progress, the social capital criteria. And the additional guidance here for social capital is that authorities should leverage community-based networks and leaders to disseminate COVID-19 related information in culturally and linguistically appropriate manners among migrant worker communities. Thank you, Omar. So I've shared in the chat box a screenshot of the number of recommendations we have until today on our rec map. And so on our rec map until today, we have 4,818 recommendations. And what we've done here is plotted the recommendations that covered any of the Progress Plus framework criteria. And we looked at throughout the year, so from 2020 until today, which criteria have been fulfilled, which have been addressed more. So as you can see, for example, in 2020, none of the guidelines that we have until today on the rec map addressed socioeconomic status. But then in 2021, we started seeing more of that. And then 2022, we have much more. On the contrary, we had more guidelines that looked at gender or sex in 2021 versus in 2022. So these are for progress criteria. And then in terms of plus, similarly, in 2020, the only criteria from Plus that was covered in the guidelines that we have until today on the rec map is the person characteristics. And then you'll see that we have a more diversity, more factors are addressed. And the reason why I'm really showing you these in terms of time is to say that we are hoping that while the guideline developers have more time on their hands now, considering that maybe earlier it was linked to urgency, they are more and more taking into consideration equity, finding more time, and maybe learning more about equity-related considerations and being more sensitive to equity factors when developing certain recommendations across time. Thank you, Omar. And just to let you know about our upcoming work, so we're looking into equity in the development of e-COVID-19 recommendations. So using the GIN McMaster checklist for guideline development. If you are a guideline developer, you're probably familiar with this. If not, I recommend that you look it up. So it covers 18 topics that guideline developers would we would recommend guideline developers to follow in order to optimize their guideline development process. And so we're looking at whether the guidelines from COVID-19 considered equity sensitive factors while looking at the 18 topics from the GIN McMaster checklist. Thank you, Omar. And so we've shared the resources in our chat box and here are the resources all in all. We'd be happy to share our slides and take any questions if you have some. Thank you.